Now, as at the morning of 26 March 2020, a total of 54 cases, including 4 deaths, had been confirmed from the regular surveillance systems. All the 4 cases that unfortunately succumbed to the disease were aged and had underlying chronic medical conditions. Now, all the remaining 51 cases are well. 14 of them are being managed at home, and the rest are responding well to treatment on admission in isolation. Now, they're awaiting their test results and will be discharged when the results are negative. The great majority of the confirmed cases are Ghanaians who returned home from affected countries. 7 of them are other nationals, namely Norwegian, Lebanese, Chinese, Dutch, and of course British. The number of confirmed cases among travelers under mandatory quarantine who have been tested is 78. Now, in respect of contact tracing, a total of 970 contacts have been identified and are being tracked. Out of these, 204 have completed the 14-day mandatory follow-up. Now let's go to Parliament, where the Information Minister has been giving some updates. Information Minister Kojo Nkrumah says the President has directed that all individuals who came into the country from abroad on or after the 12th of March 2020 be identified and tested for COVID-19. He says they are to be tested as has been done with those who arrived on Saturday night, out of which many positive cases have so far been detected. Now, he says the Ghana Armed Forces have begun lifting and distributing items donated to Ghana by the Jack Ma Foundation. He's been addressing the media in Parliament.
A good majority of all the cases that Ghana has recorded are persons who came from abroad. Out of this new 132 that has even been updated now, about 78 of them are those that were put in mandatory quarantine. And a good chunk of the 54 or so that are from the general surveillance, a good chunk of them were persons who also came into the jurisdiction. It would have been dangerous if we didn't have a system to trace them and to test them and know. That's when we would have really had very severe risk. But thankfully, we've been able to contain it. Even though that has happened, the President is still interested in finding measures by which we can ensure that we don't even run the risk of significant communal spread. And he continues to review the various options and scenarios and advice that comes to him. So if it becomes necessary that we have to go that far, he will not hide anything from the people of Ghana. We will do well to let people know why those restrictions, if indeed it becomes necessary, will be imposed. Remember that these restrictions are not done for the fun of it. They are very important, and so far we have all been supportive in our own interest. For example, when we said people should go into mandatory quarantine, you recall that some initially were apprehensive, but now the data that is coming out shows us that that restriction itself was in their own interest and in the interest of the 30 million Ghanaians. So if it becomes necessary that we must have some further restrictions in our own interest, His Excellency will do well to take that decision and will let all of us know. As at now, the data available to us, 78 from quarantine, out of the 54 from surveillance, the majority, we are told, also coming from persons who have traveled, does not suggest to us that today, right now, we are going into lockdown. No. But if that decision is made, we will do well to let the people of Ghana know. Let's say the Ghana Medical Association had suggested it and we had said no. And then they had come out with a press statement. I don't quite recall that even at the meetings where they are apart, they have even tabled a proposal that even deals with the various scenarios. Calling for it is not the difficult part, but handling the various scenarios. The millions of Ghanaians who literally live on a hand-to-mouth basis on a daily basis. If you lock down everything for 14 days, what happens to them? What happens to people who need sanitation, toilet facilities, all of those things? You need to consider all of those. What are the security dimensions? I think this morning we were reading that Jordan earlier went into a lockdown, now has had to come back because security was now becoming something difficult to maintain. So it's not, something that you take lightly. You have to weigh and consider the various scenarios and how to enforce it, etc. And all of those are options that remain on the table. Social distancing.
You have said yourself that if the FS advice as such, government will consider.
Yes.
Now they have the Ghana.
Which experts are those?
Oh. The party holding the decision.
No. But you see, it's not a one-dimensional decision. It's not because, let's say, one group says it, then that is it. You will hear from the doctors. You will hear from the food security experts. You hear from the human security experts, the national security people, all of that. So if one dimension says X, you've got to also subject it to the views of all the other persons around the table and even model the various scenarios for it before you arrive at a decision. These decisions are not made lightly, but we are clear in our minds that today where we stand, we've been able to largely contain the potential importation of cases and continue to review the options, and if we need to escalate in the final raft of measures, His Excellency will do well by the people. You know, it's in about 3 stages. They must first take samples. Taking sample doesn't mean tested. And it takes about 30 minutes to get a good respiratory sample from any of them. We're talking about 1,030 people. So they have taken samples, last time I checked, I think from about 900 and something. And then they have processed through the PCR system a little, I think, over 300 or so. In the next update, we'll give you the very specific numbers. It is out of that you're having about 78 who have ended up testing positive, which was a huge risk if that had not been done. Our expectation is that by Thursday, indeed, we said by Thursday morning, those were the numbers they were giving us. They'll be able to finish all of those ones. They will do their best. They are working around the clock to finish all of those ones so that they can give us the answers.
The last engagement we had together with you and then even the health minister, there was an announcement to the effect that those who had entered the country prior to the kicking in of shutdown will be traced.
Yes.
So that's very critical.
Yes. The Ghana Immigration Service, working with the Ministry of Communications and their agencies, has the whole database of all of these persons who came in. Initially, we were looking around the 15th, but the President has asked us to go back as far back as the 3rd. So all of that data is available. Some of them have already done 2 weeks, who have not even shown any signs of having been infected. So they just need to do that kind of separation of that data. And then they are going through a process of ensuring that those who need to be tested in that pool are tested. That's the level of the mass testing, quote unquote, that they intend. Those are the at-risk populations that they intend to test, just to be sure that we don't have any, apart from what we've contained, we don't have any hiding in the general population.
50,000 testing kits from the...
That'll be your last one, then I'll go to others.
The 50,000 testing kits that the President mentioned that procurement processes are underway. How far advanced are we? And the Jack Ma's donation?
I know that the Jack Ma Foundation items arrived, I think yesterday they were received. The Ghana Armed Forces has been assisting the Ministry of Finance and the Ghana Health Service to do the distribution. Indeed, I understand that some are already being flown to other parts of the country to circumvent the traditional system where to go to the regions and go to the districts. They are trying to cut through and get some direct supplies because our doctors and our nurses are the first line, and we must ensure that they are protected as they engage with potential cases and also know the case management protocols that are out there.
You just said that government was considering suggestions from other quarters. At which stage will government decide that, okay, at this stage, something is ready for us?
If it becomes necessary that the country should be locked down in whatever form, that will be the state if it becomes necessary.
Financially, are we ready?
The President has instructed the Minister responsible for finance to first of all build the economic impact assessment, which he did about, I think, 2 or 3 weeks ago and even presented parts of it to Parliament. But he has also further instructed him to work out the implications of any further measures on the economy and how to put in place economic measures, what people call a stimulus program, to ensure that these measures don't adversely hurt the economy and people. And all things being equal, once he's done, he will brief the nation through Parliament on the economic measures that are being used there.
James Agalda is calling for amnesty to release petty offenders out of the prisons, to decongest the prisons. So
I think about a number of days ago, His Excellency the President instructed the Minister responsible for the Interior and his team to work out what that possibly means and if it was feasible and recommended. They are yet to submit their recommendation. It will be looked at and a decision made.
What timelines are you looking at?
I don't have a timeline to that.
Assurance to the public, there are some social media messages going on that there's going to be a lockout this Saturday What assurance?
I've just explained all the conversations around that. Do you have a question?
Is there any plans to get additional tests like centers for the northern sector?
I think Noguchi has explained how they are going about that. I won't want to go into that.
How are they faring? It seems
The Ghana Health Service tells us that a good number of them are doing very well. We've asked them to give a breakdown of those who are responding to treatment, who are recovering, or who may be in critical condition. So we've challenged them to put out that data very quickly so that people also get a fair sense of how, so let's expect that data hopefully before the day is over.
I'm talking about the data.
No.
They seem to be
There were
having a
two
back.
figures of people who were dead. I mean, from Ghana Health Service, we hear 3, but from other reports.
Which other official report is this?
I have